Welcome from Henry Ford Jackson Hospital Emergency Services physicians, Dr. Kevin Killian and Dr. Alan Lazzara, and from the Jackson County Animal Shelter, Lydia Sattler. Welcome.
Thank you.
Hey Bart, how you doing?
Welcome back to Alan and Lydia. First time welcome to Kevin.
Great to be here.
Yeah, great to have you here. And you guys are part of the great staff at the emergency room. Here comes summer.
It's right around the corner.
It's a busy season in the ER.
Always.
Yeah, for sure.
Yeah.
So do dogs have something to do with emergency room visits? Should you bring your dog to the emergency room?
We would probably avoid bringing the dog to the emergency room, but with the nicer weather and people getting out there in the parks and everything, we do unfortunately see some incidences of dog bites coming in a little more frequently than we would like. Certainly something that we see in the emergency department can be in a medical emergency. Usually always needs to be seen by at least a doctor.
Mm-hmm. Yeah, and we just remember Brandon at Bright Wells a few years ago. It was just a peaceful picnic concert, and all of a sudden this what seemed like a nice dog bit someone. And it seemed like, wow, that's a lot of blood for one bite. Lydia, how do you know if a dog is, I guess, prone to biting?
Well, I think you can't really know that in advance, but I think there's steps you can take to make sure that you're protecting yourself and keeping the animal, feeling that it's safe. One thing, if a dog is attached to a person, always ask that person if the dog is, if you can approach the dog. Avoid leaning over the top of the dog. We want to naturally go like this and pet over the dog, but that can feel like you're trying to be dominant over the dog, and that can, cause the dog to react negatively. So, go ahead.
What kind of dog do we have right now?
Lola's a mixed breed dog. We're guessing
Rosa?
Lola.
Lola.
Mm-hmm.
Lola.
She's a mixed breed, so she's probably in the bulldog family. She's only 9 months old, but she, I think a lot of people see obvious signs of aggression, and they would be fearful if someone was showing their teeth or growling. But it's really paying attention to those subtle signs that we may not associate with a dog that may bite. Fear, a dog can bite out of fear. A dog can bite over guarding something that's important to it, like a person or a toy. So watching for subtle signs is really a key to making sure you're being protecting yourself.
And I think one of the things that we see, unfortunately, with some frequency, I'm a dog owner, dog lover, animal lover, etc. I think we all are. Killian, I know you got a dog. Right?
Yep.
Toby.
Yeah.
I'm on the
Toby.
fence.
You're on the yeah, right. But we just got a newer puppy, and so we had to teach our children how to be around an animal, and that was a learning experience for me because I'm a first-time dog owner, and so learning all those different steps. But sometimes we see in the emergency department, we see younger kids, unfortunately, that startle a sleeping dog or approach a dog in a way like a 2 to 5 year old, and it's really because that dog doesn't want to bite a little kid, and it's obviously a mistake, and the injuries are very traumatic for everybody involved, and that's one of the things that I would caution parents about it. That's a great point about teaching your children how to approach a dog. What are the kind of more passive steps to introducing yourself as opposed to startling it, But Dr. Killian is one of our chief residents. We have 2, and he's moving on to do a sports medicine fellowship in Cleveland, but he's seen his fair number of dog bites here while an emergency medicine resident, and so he can tell us a little bit about how we treat these dog bites, what we do, and the medicine behind it, so there's no bigger surprises when you show up.
Yeah, so typically, things you can do before you even, seek medical advice is, wash out the wound as best you can with any source of clean water, and then put some pressure on the wound with a towel or some sort of absorbent, rag or something that's preferably clean. Then when you come to the emergency department, we usually try and get you back as soon as we can. Take a really good look at the wound, certainly looking for big, concerning signs, things like is there any muscle, ligament, tendon, nerve, or vascular injury that we need to address right away? Is there something that might need a surgical intervention that we need to get more hands on deck kind of sooner rather than later? So once we do that initial evaluation, then we kind of look at cleaning the wound out as best we can and looking for anything like foreign bodies, any plant material or anything, or any missing teeth. Oftentimes that'll require an x-ray since I don't have x-ray vision yet. And so we'll see if there's any bony damage or any foreign bodies left behind. And then from there we kind of make decisions as to how we should go about taking care of the wound. So that can include taking out some of the dead tissue that doesn't necessarily isn't going to make it, whether we close it with sutures or not. Sometimes we have to stitch very large wounds, kind of loosely approximated. Other times we have to do it for cosmetic reasons, especially if it's on the face. The biggest risk with all this is mouths are dirty. Dogs greet themselves by sniffing their butts. They lick all kinds of things. Now it's in your wound. So washing it out is a big thing, but then starting antibiotics and updating tetanus shots. I know there's some concern about rabies as well. Fortunately,
That would be my concern.
yeah.
Especially if it's like a random dog that we don't know whose it is.
Yeah, we have a Michigan Department of Health and Human Services protocol that we follow. If the dog can be observed for 10 days, if it's a known animal, we are in contact with the animal control for Jackson County as well. And so if it's a complete stray, we have no idea where the dog came from, then we do give the rabies vaccine and immunoglobulin, but it's, like Dr. Killian was saying, it's exceptionally rare. We're more worried about bats and raccoons. A bat that's flying around during midday is not a normal bat. It probably has rabies, so you should don't pick it up, just call animal control. But generally domesticated animals are not not a reservoir for rabies in the United States. Outside the United States, yes, but not here.
So you shouldn't try to capture the dog to get it tested for rabies.
I probably wouldn't do that. I just call animal control or police.
Call the professionals.
Yeah,
Animal
for
control,
sure.
they do. We receive anytime an animal bite happens at the hospital, those reports come to us as well. So we follow up with the owner of the dog if known. And we do require quarantine for that dog for 10 days, and then we recheck it afterwards to see if it shows any signs of rabies. So if you do receive a dog bite, make sure you do contact animal control, even if you're not seeking medical treatment for yourself.
And dogs have to be vaccinated for
Correct.
rabies.
Correct.
Yeah.
By
Even if they have
veterinarian.
religious exemptions.
Exactly. They don't get a pass.
Even if it goes against their dogma. Well, I'm waiting all day for that.
Good one.
Well, one of the other things too, so the rabies vaccine is not a medical emergency, it's a medical urgency. So we can wait that amount of time to determine, well, it depends on the protocol, right? We end up usually giving it for most people right away, but if for some reason it was like a day or two later, we would still give you the rabies vaccine, but you should, and update your tetanus as well. And we give Augmentin, we call it Dogmentin, because we give it for pretty much all dog bites unless somebody is allergic.
Ooh.
Yeah.
So we want to prevent the dog bite or dog attack in the first place. And Lydia, there's some things people can do. Now, if Alan came to you with his brand new puppy, you would give him some ideas on how to get the dog acclimated with, how young is your youngest?
7.
7, okay.
7,
so
9, 11.
It's not toddlers in preschool. Those are the ones that really that poke an eye of a dog and can provoke.
Right, and I even think even with 7 years in that age group, you're thinking that they're older, they're not going to pull on the dog's ears. But a lot of times you're not paying as close attention, and someone wants to hug a dog, and maybe that dog does not want that kind of contact. So there's a long list, but we really strive at the shelter to make sure we're meeting having people meet the best match for their families. And if they are going to a home with small children, we have a long, not super long list, but we have a lot of tips to help them integrate that pet into their household in the safest manner possible, so that we're setting them up for success.
And you have a rule of 3s.
Yes, the rule of 3s. I think we offer sleepovers at the shelter so that people don't have to adopt on the spot, but they have an opportunity to take that dog home, let it stay with them for a few days and see how it fits into their household. But they shouldn't expect overnight for a dog to show everything that it's going to show. 3 days to kind of just figure out where it's at. 3 weeks to really relax and start show its personality. And after 3 months, the dog should be fully acclimated to the home. So patience is key when you're bringing any new animal home.
I would say as a new dog owner, that's pretty much spot on from watching the two dogs get along. And he was very hesitant at first, and then 3 weeks relaxed a little bit, and now he's like jumping on the bed all the time.
He's home, yeah.
Yeah, for sure.
Letty, the fact that you've got your foot on Lola's tail, that's not going to cause her to bite you when you get up and leave?
Is that happening right now?
No.
Oh, we're close, right? Yeah, that would
No,
probably
you're very
be.
close. Not quite on it. I think she'd let you know.
Yes, I think she would probably, that would scare her a little.
People have this misconception about certain dogs, certain breeds being more prone to being, grumpy or dangerous, right?
Yeah, I think on that point, that I wouldn't say there's a propensity for a particular breed all the time. I think it really depends upon how the dog is raised and how they are trained, because we see all types of dog bites, and some of the damage can be more extensive because some of the dogs have much stronger jaw muscles.
Yep.
But really, they're just like children. They're kind of a reflection of their parent or their owner, and I think that it requires a lot of responsibility. I've learned that it's hard to do. It's not easy, but training takes time and it takes effort. So just like with kids.
And they're breeding too.
Yeah.
And their lineage.
Yeah.
Makes a
And
difference.
dogs sometimes can be abused, and so they have to unlearn that kind of, or relearn trust and stuff. So it's a hard thing.
So you've seen some horrific injuries from dogs that come into the ER
Yeah.
where you think, oh my gosh, a dog did this?
Yeah, and oftentimes, you get the story of, and you're listening to what the people are saying, and you're like, oh, well, they were, the dog was cornered, and they weren't familiar, or they were a stray who had gotten away from a bad situation. So usually you can kind of piece together, that there were obvious triggers, and there were things that caused the injuries, which is unfortunate. But I mean, we have a great staff at Henry Ford. So on the more terrifying and, pretty mutilated folk, they've had really good outcomes. We've had really good care.
Yeah.
Props to our trauma service and our surgeons who can help wash out the deeper wounds and kind of put people back together from that perspective. And,
I would say most of our dog bites are actually handled in department, because as emergency physicians we do procedural sedation. So for, say, a child that had a bad dog bite, whether it's the face or the arm, a lot of times, and I know I've done this with Kevin, we'll double team at the same time to make the sedation as short as possible. So both of us will go in there and irrigate and sew and numb everything up, and so we use a number of medications so that the person doesn't even really remember. And they're monitored the entire time, and it's pretty remarkable how few times we need to call plastic surgery. Sometimes we do. If it's really extensive, it's going to take an hour plus, then it's like we need a surgeon to be able to take to the OR. But if it's, a lot of times these get put together in 15, 20 minutes, and we do lips and ears and all sorts of stuff. But there's some no-no spots, like where the eyes come together, that require oculoplastic surgery, or if the face has a lot of significant damage, that they may require plastics. But it's definitely not the norm that they require that.
And it's so traumatic. There are people that can never be around another dog again the rest of their lives. Right?
Yeah.
So true. We see a lot of kids that come in that have had some kind of bad experience, and their parents are trying to, reintroduce them to dogs, and they're so fearful. So that definitely is a thing. But like you said, just circling back to the breed, any dog can be fearful and bite. Any dog can truly be aggressive. Any dog can, just kind of be guarding something that's, important to them, and, lash out if you get close to it. So it's, and like you said, it's more the size of the dog that can do more damage, is I think, why people think they see this certain type of breed is so dangerous, but they're just stronger.
Yeah.
So.
But certainly for every dog bite we see, there's probably millions and millions of interactions every week that are positive.
Right.
So it's a rarity. But I think the point of this, when we do these, is to not only help people prevent, because I'm big on an ounce of prevention is worth a pound of cure, because nobody wants to see these, and hopefully some of this is helpful and takes away some of the fear of having to come to the ED and having to, deal with a dog bite if it happens.
Yep. Just take those steps to prevent a dog bite. Like, take it slow, watch for signs the dog may be fearful, or any other signs the dog's trying to tell you to back off. In most cases, we just have to make sure we're paying attention.
Yeah, and they don't make good babysitters.
No.
No.
No. No.
All
Missing
right.
those thumbs, you know.
Right.
Yeah, but when in doubt, and really, if you're injured, go to the ER.
Yep.
Mhm.
We'll
Right.
take good care of you.
Awesome. Well, we wish you the best as you head off to Cleveland for your fellowship.
Thank you.
And thanks for all of you coming in and helping our viewers today be safe this summer.
Thanks,
You too.
Lola, too, right?
Yeah, Lola's been
She's a
doing
good dog.
good.
Thanks, Lola. Does Lola, can she do any tricks?
This is it.
This is it.
Yeah.
All right.
She can be
Lay.
good. Thanks for having us.
All right. Thanks a lot. Lydia Sattler, Director of Jackson County Animal Shelter, along with ER physicians, Dr. Alan Lazara and Dr. Kevin Killian. A lot more coming